This is the Dentist News Network. I'm Danny Davis. Orthodontic treatment is something common for not only children, but adults as well. Orthodontics is not just about moving teeth, but can also include treating skeletal issues. My guest is Dr. Charles Wait, an orthodontic specialist in Scottsdale, Arizona. Welcome, Dr. Wait.
Well, it's nice to be here. Thank you.
Let's talk about treatment phases. What's an early partial treatment?
Well, an early partial treatment, when orthodontics is considered, is recommended if there are certain type of problems that may injure the teeth or may cause adverse growth potential. We follow the development of a child, and if they are developing a certain type of problems which would go uncorrected, would produce more severe problems, we intervene at an earlier age. For instance, if a person would have what we describe as a crossbite, scissors bite, maybe as a person would know it, where a top tooth is trapped behind a bottom tooth, this would be a 100% indication for early intervention. A constricted top jaw, where all of the unerupted permanent teeth would come and erupt inside of the lower teeth, would be another indication for early treatment. A skeletal problem with an underdeveloped top jaw or underdeveloped bottom jaw could be treated at an early age. There are other problems that would indicate an early phase of treatment. However, we monitor patients, and the vast majority of patients are treated with one phase at approximately 10, 11, 12 years old. It's dependent on the eruption of the permanent teeth.
Now, what's the difference between tooth and skeletal discrepancies?
The tooth position is very important in long-term stability of the patient's dentition, in other words, occlusion. The teeth need to fit together like little gears, and braces are very effective at aligning teeth and obtaining the proper occlusion. However, there's often a much larger problem present, and that is the skeletal discrepancy, which you have alluded to. The skeleton being the top jaw or maxilla, or the bottom jaw or mandible. There can be horizontal discrepancies or vertical discrepancies, constrictions of either jaw, lack of growth of either jaw. We have appliances in younger patients where we can promote growth, we can expand, we can advance the lower jaw with a number of different appliances. And in the adult treatment, sometimes it is augmented with a combination of orthodontic treatment and actually moving the jaw with a surgical procedure. An oral surgeon and other specialists would be called in to assist with this phase of treatment, and then the orthodontist would complete the alignment of both the skeleton and the teeth.
In the case of a child, is it a good idea to wait until all the teeth come in before treatment, or is it sometimes necessary to see a patient earlier than that?
Oh, we definitely encourage not waiting for full eruption of all the permanent teeth. That can result in unnecessary extraction of permanent teeth and a limitation of how much can be done orthodontically to correct the malocclusion. We would want to do a first exam on a child at about 7 years old, probably not treat the child, but make some notes and follow the growth pattern of the child, treat any existing conditions that would necessitate an early phase 1 treatment, or follow the child until the appropriate eruption has occurred, and then put the full braces on. It's more of, the timing is more of the eruption of the teeth versus the age of the patient.
Now, is it possible that more braces are going to be needed after phase 1?
Yes, that's certainly possible. Most phase 1 treatments are to correct either a skeletal problem or an impinging crossbite situation. And the early phase 1 treatments are limited in scope. They're shorter. They involve just a few permanent teeth, and then the braces are removed. and there's many more permanent teeth to erupt. Usually they do not all erupt into the proper position, although they will erupt into a much better position after phase 1 treatment. But it is likely that a shorter full set of braces would be needed later.
Thank you, Dr. Wait.
You're welcome.
For more, visit dentistnewsnetwork.com. Thanks for watching.